Hi, I'm Dr. Mathis. I'm here to talk to you about dental care. And Natasha is my assistant today, and she is going to ask some questions that we commonly get about dentistry.
Dr. Jen, how can I care for my dog's teeth at home?
Dental home care. It's not all it's cracked up to be, but it really does make a difference. So dental home care is helpful. There's all sorts of categories of specialized food, like prescription food, that actually makes a big difference. There are specialized chews, but not all chews are created equal. A lot of them are mechanical or just marketing. In fact, some things that are marketed as dental chews actually can break teeth, so you have to watch out for those. There are specialized rinses, and then we have brushing. Well, brushing I used to think was difficult, and actually we can make it easier by using dental wipes. And that is my recommendation, because when they compared brushing to any of the other forms of home care, basically to chews and food, brushing worked 3 times better. And so it really does make a difference. In a study of pets that had their teeth brushed, when they were brushed daily, it was beneficial. When they brushed every other day, it was half as beneficial, but still helpful. When it was done less than 3 times a week, it was equal to not doing it at all. So when you have your groomer brush the teeth, it's less than 3 times a week, probably equal to not doing it at all. So what I have to do now is remember to use the wipes, and I set an alarm on my phone to remind me to do it, because that's the hardest part about the home care, is remembering to do it. The good news about home care is that pets that have dental home care, it showed that they were 2 to 3 times less likely to have problems in a year, but 15% of them still had problems in a year when they had their teeth brushed, whereas 44% had problems in a year when they didn't have home care. So home care really does make a difference.
What are some signs and symptoms of dental disease in dogs?
Symptoms of dental disease. The problem with most dental disease is that it's hidden. By the time you see symptoms of pain when yawning or pawing at the mouth, those kinds of things, usually it's gone on for quite a bit of time. The best way to check for symptoms is to have a dental procedure to evaluate all the teeth every year, because that same study I just mentioned showed that they cleaned all the teeth, they got a nice clean slate, they came back a year later, and about 15% had a problem in one year later when they had dental home care every day, and 44% had a problem 1 year later. And those are usually things that were unknown. Oh, one other thing. We also have AuraStrip. AuraStrip is a test we can do. It takes about 15 seconds, and it can tell you if there's bone loss around teeth, which is the leading cause of hidden pain in dogs.
What are some of the common dental diseases in dogs?
So the most common is periodontal disease, which is bone loss around the teeth. It happens when, it's a long explanation how to best simplify it. Plaque accumulates and the body responds in a unique way to each individual patient, and that response, as it accumulates, changes what's in that plaque and results in some bone loss in the gingival sulcus, which is the space between the gum and the tooth, which is below the gum line. So all these changes are happening below the gum line, unseen, and you don't know it. So periodontal disease is the most common one. Other things I see are oral tumors. I see malalignment of teeth. I see broken teeth. One study showed that 28% of dogs had at least one broken tooth. Sometimes they're a chip fracture, which has exposed dentin tubules, which have little tiny nerves in them. Other breaks are into the pulp chamber, and those need root canal therapy or extraction.
Why is early detection and diagnosis of dental disease so important?
That is a definitely important question. It's important to find it early because it's usually rather simple to treat and give them better outcomes. Dogs have 42 teeth. Of those, 8 are important ones. We want to work to save those important teeth. Sometimes it'll be an unimportant and small tooth, and the disease around that tooth progresses below the gum line to an important tooth, and then we maybe can't save that. And so it's those 8 important teeth of the 42 we want to work to save, and that's why we need to find things early, and that's why annual anesthetic dental procedures is necessary.
What is a professional dental cleaning like for a dog?
Good question. So a dental procedure consists of evaluating them and getting them ready for anesthesia. The anesthesia risk is actually very low when you pay close attention to everything. The anesthesia risk is 0.05%. For me, that's like 1 in every 10 years has a problem. So I don't want that to happen at all, and I want to keep that risk low, so I have to pay attention to make sure I'm looking at everything. So we look at blood work in our office, and that is liver, kidneys, electrolytes, red blood cells, white blood cells, platelets, pancreas, blood sugar, and proteins. And we also do a heart muscle enzyme test. And I use that information to figure out what drugs to use, either a different drug, different dosage, also the fluid rates and those kinds of things, because then we go to anesthesia. Anesthesia consists of placing an IV catheter. We shave a little bit of hair and we induce anesthesia. We monitor anesthesia, and someone is with them and working with them and making sure things are adjusted and they're where they need to be, so we can have that safety there. If things aren't going the way we want them to before there's a problem, we will wake them up. That rarely needs to be done, but that is a possibility. But that's why we pay such close attention. And I'm used to dealing with patients that have heart problems and kidney problems and things like that. After we've induced anesthesia and we're getting ready to look at things and monitoring, we are then taking x-rays. In my case, we're often using 3-dimensional x-ray, and we get all the images, around 1,000 images in about 90 seconds. And then I'm looking at those while the team members are cleaning the teeth. Other times we do intraoral x-rays, which are x-rays of each individual tooth to make sure we get those areas, and those are very detailed as well. And we look at all the teeth and make sure there's nothing missing. It's important to look at everything, because sometimes there's things hiding below the gum line where there is no tooth and there's actually a cyst or something like that. So then we talk to you about x-ray results, and then it goes to the treatment. If there's a treatment to be needed, we talk to you about it, and you can choose if you want to do that or not. If their x-rays are all normal, that would be wonderful. And we'll just clean the teeth. And that's a 25-step process and get them into recovery. Now, x-rays actually show, some studies that haven't really changed, show that 3 out of every 4 pets has a problem hiding that you see on x-ray. You don't know how to treat it properly without it. So that's why it's so important. Your chances will decrease when you have annual anesthetic dental procedures, but x-rays are really important at revealing those hidden sources of pain. Well, thanks for joining us. I hope you got your questions answered. And if there's other questions, feel free to reach out to us. Thanks.